So we were talking about stroke the other day, and I told you stroke is just a damage to the brain. No agbo can cure stroke, oh. Because why? That part of the brain that is damaged. Remember, the brain is divided into two parts, and they are responsible for even blinking your hand or moving your hands like this. So now let's talk about what stroke is and how to know when someone has stroke. First of all, stroke usually happen. It can happen in anybody, but it usually happen in people that is like 35 years upward. It can happen in children, oh. So here's how to know stroke. First of all, we call it the fast approach. FAST. The first one is the face. What are you going to tell a stroke patient to do? You tell them to smile. When they smile and one side of the mouth is dragged to one side, that's what it shows that they stroke. Then the next one is to raise their hands up. You tell them to move one hand up and carry the other hand up. If, for example, the patient is able to do this, carry one hand up, and this other arm is finding it difficult to do it, that means what? There's a stroke. Another one is what? Is the S, which is the speech. What are you going to tell them to do? If it's your family member, just tell them to ask them question. Have you eaten? And the patient is trying to answer you, and what is having a slurred speech like have eaten or those kind of things. That's another thing that tells you that what there's a stroke. And the thing is for what? Time. You are not supposed to waste time. All these things I told you to do now, you are just supposed to do it in like 3 seconds. You understand? So the next thing to do now is the time. You have to be very fast. Take the patient to the nearest doctor because your brain is getting destroyed every little minute that you are using. You understand? So take them to a nearest health center.